Honorable delegates, we shall now proceed to the first order of the day, and that is the policy debate on Budget Vote 18 on Health Appropriation Bill B16 of 2025. I have the pleasure now to call upon the Honorable Minister of Health, the Honorable Motsoaledi, to address us. Honorable Motsoaledi, you have 20 minutes to open the debate. Thank you.
Thank you. Honorable Chairperson, my colleague, Deputy Minister of Health, Dr. Joe Phaahla, Chairperson of the Select Committee on Health and Social Services, Ms. Desiree Fennis, and members of your committee, honorable members, distinguished guests, MECs in the House and on the platform, ladies and gentlemen, greetings. Thank you for this opportunity, Honorable Chairperson. At a very challenging time in the history of our country, including complex geopolitical events of recent days, I believe this House is eager to hear how we plan to navigate through these complexities. Basically, we have got three main objectives in this budget. Objective number one is to lay a strong foundation in preparation of improvement of public health system of our country, to lay the ground for the national health insurance. And there are people, of course, who believe that we have no plans at all, or we have got no inclination to try and see if we can improve, especially the infrastructure in public health services. We want them to listen very attentively today. Secondly, our objective is to lay a strong foundation and to embark on the journey towards elimination of certain diseases, especially communicable diseases, but not leaving behind non-communicable diseases. Honorable Chair, one of the mistakes we do in healthcare, and I hear a lot about it even from leaders, is to believe that healthcare is only inside the hospital and that certain diseases are here forever and they are here to stay. And we want to differ strongly with that. Our third objective is to try and implement serious reforms in the private health sector. Please ignore those who want us to believe that there is nothing to fix there. We only have to deal with the mess in public health, as they always tell us. Let me come to this issue of health infrastructure. One of the biggest problems that public health system encountered and was severely criticized for is the health infrastructure. The broadside the sector received is exemplified by the encounter at Helen Joseph Hospital in Gauteng. The complainant lodged to the Health Ombudsman 7 complaints. 5 of them were dismissed because they said there's no problem there. The 2 that were upheld by the Health Ombudsman is infrastructure and human resources. The 5 that were dismissed as unfounded is clinical protocols, meaning we have got people who have got enough skill, who have got enough knowledge, who are doing the correct things, and they are just being let down by lack of infrastructure. So we need to fix these 2 that were upheld. For the record, the following new facilities were completed during the financial year 24-25. Number 1, Sipeti Hospital in Eastern Cape, Ladysmith Clinic, KwaZulu-Natal, Henning Flay Clinic in Northern Cape, Buchebuk Clinic in Northern Cape, and Bangara or Budulon Clinic in Northern Cape. Additionally, during the reporting period of 2024-25 financial year, 47 existing clinics and community health centers, as well as 45 hospitals, were substantially revitalized, while 403 public health facilities were maintained, repaired, or refurbished. The following new and replacement hospitals are already under construction, representing a significant step in strengthening the public health system and improving service delivery in provinces. In Limpopo, we are constructing a central hospital. As you will know, throughout our whole democracy, we had only 10 central, or what you call academic hospitals. 1 is in the Eastern Cape, 1 in Free State, 2 in KwaZulu-Natal, 2 in Western Cape, and 4 in Gauteng. And there is none in 3 provinces. There was none in 4 provinces rather. Limpopo, Limpopo, Northern Cape, Northwest, and Mpumalanga. Now the Limpopo one has started and is at 26% construction. This is going to be a flagship hospital for the whole province and for the Faculty of Health Sciences, which has just recently established a medical school at the University of Limpopo. Now, the other hospitals that are under construction is Selam District Hospital in Vembe, which is 90% completion. The Tlhabeng Regional Hospital in the Free State, which is at 30%. Bambisana District Hospital in the Cape, which is at 82%. Zitulele District Hospital in the Eastern Cape, which is at 50%. And Bophelong Psychiatric Hospital rather, under construction in Northwest. In addition to the hospitals currently under construction, the National Department of Health has prioritized several key projects placed strategically to strengthen South Africa's public health hospital network, particularly in high-demand areas like Gauteng, but also in underserved areas, which are mostly rural. This includes 17 major hospital projects, which have been identified for development, and they are at various stages of design and development. The biggest of these huge projects are a total replacement of 3 major central academic hospitals. Number 1 is Dr. George Mukhari Academic Hospital under Sefako Makhatu Health Sciences University in Gauteng. It started long ago, but it was never built. They were using a district hospital. The second is Nelson Mandela Academic Hospital under Walter Sisulu University in Mthatha. Also started many years ago, but was never built. The last is Victoria Mxenge Hospital, formerly known as King Edward VIII Hospital, under University of KwaZulu-Natal in KZN. It also was never built, and we want to do so now. We wish to add 3 new central hospitals or academic hospitals that exist, that do not exist and have never been there before. Number 1 is Mpumalanga Academic Hospital. You know, they've just acquired the university. But we're planning that in future, they must get a medical school also. And the second is Northwest Academic Hospital. They've already started the medical school, by the way, in Northwest, but there's no academic hospital there. We'll need to build it. And the last one is in the Northern Cape. These 3, in the 3 provinces where there was none, are still in the very early stages of planning. Their entry into the health sector network will wrap up our academic hospital from 10 to 14. The extreme overcrowding in our public health facilities is caused by rapid population growth and rapid urbanization. Please remember that the public health system is utilized by 86% of South Africa's population, and none of them are in this house today, except myself. You throw in a mix of our neighboring countries. And honorable members, if we do nothing about this situation, I can assure you the scenes you see on TV of pregnant women sleeping on floors and on chairs will be the order of the day, unfortunately. We have got clear evidence of this in Dorang Ginza Hospital, which is always on TV for wrong reasons. Even the public protector went there on her own and agreed with us and said that problem, which people believe is just a problem of management, is a problem of overcrowding. And even the public protector instructed, we need to build new district hospitals in that area. And we are planning to do so. When Bheki Mlangeni Hospital in Gauteng was built, the aim was to relieve Chris Hani Baragwanath Hospital, which is also very overcrowded. I can assure you today that is woefully inadequate. Bheki Mlangeni is already overcrowded. So we need to urgently add many more if we are to make impact. So we are planning a new hospital in Diepsloot District Hospital, new hospital in El Dorado Park, new hospital in Soshanguve, new hospital in Dobsonville or Meadowlands, and a hospital in what is called the Holomisa settlement. We are also on the verge of total replacement of old missionary hospital, like Elim Hospital, those who know it in Limpopo. was built by the Presbyterian Mission is completely dilapidated. There is just no way of refurbishing it. And we have got plans together with Chilihini's hospital. It's not a mission hospital, but it was built in the early days of the Venda government. They are totally dilapidated. Fortunately, these two, we have completed everything. We shovel ready. We're just waiting for Treasury to say, here is money, go ahead. And we start immediately. 5 new community health centers are also muted. The Genge Community Health Center in Eastern Cape, Kraaifontein in Western Cape, Kwamakuta in KwaZulu-Natal, Katomayana in KwaZulu-Natal, Mitlokong Community Health Center in the Free State. We will include in our program a building of totally new psychiatric hospital in Mpumalanga. This embarrasses us. Mpumalanga is the only province that have never had a psychiatric hospital throughout its own existence. And we believe that must come to an end. Needless to say, honorable members, this project, as you can hear, are very substantial and will take several years to plan, to decide, to construct, and even to commission. We do not necessarily have all the money for this massive infrastructure, but we are speaking with international financial institutions. We've been discussing with Treasury from time immemorial, and we are speaking with all the other financiers. The reason that we are doing so, honorable members, is that if we don't do so, we are going to end in the situation which Eskom found itself in today. When they were told some years back to build more power stations and they were nowhere put out, our hospital infrastructure is leading to that. This places where we are going to put the hospital is not thumbsuck. We're not just guessing. We are using a digital system called which utilizes geographic information systems. The system that we are using is called HIPS, or Health Infrastructure Portfolio System. With HIPS, you take geographic information system, you take district information system, you go to Stats.SA, you put in the total population in that area, activities, and the system it tells you where to put up the hospitals. So when I'm mentioning all these hospitals, it's not thumbsuck, they've been informed scientifically by that system. Other measures to strengthen healthcare system. I want honorable members to understand the huge difference between private hospitals and public hospital is infrastructure, as I've said, but also equipment and other facilities. Now, you are aware that health suffered tremendously over a decade, where there were budget cuts, austerity measures. Treasury told us they want to move away from austerity measures in this budget, and that was the beginning. Hence, we've been given 6.7 billion rand this year, and we'll get another next year and the third year, so that we try and get out of this austerity. What have we decided to do with this money? We met with all our 4 provinces and agreed that with this 6.7 billion, we need to hire 1,200 doctors, 200 nurses, and 250 other healthcare professionals. This will cost us 1.7 billion. We also need to acquire 1.4 million articles to make public hospitals hospitable, because that's where our weakness is. We're not hospitable. We will buy new beds, mattresses, pressure mattresses, bassinet for babies, and new hospital linen and towels. Bassinet for babies, members may remember what we once saw on TV, which was heartbreaking. Children being put in cardboard boxes in Northwest because they had no bassinet. We are ordering 76,000 of them for the whole country. This will cost 1.3 billion overall. We also want to employ permanently community health workers who have been in the system for close to 2 decades, some of them for even more than that, and we want to employ 27,000 of them. Lastly, we want to start a journey to pay our accruals. All our 9 provinces owe suppliers a lot of money simply because of budget cuts. And so we want to start a system of paying. We'll start with 3.75 billion rand for this financial year and keep on paying for the next 3 years. as part of this budget that the Treasury has promised us. The elimination of certain diseases. Number one on our radar screen is HIV and AIDS. You know that there is a plan internationally to bring this disease to an end. It has been designed by the UNAIDS. It's called 95-95-95, whereby if in your country or in a particular setting, 95% of the people who are known to be HIV positive know their status. If thereafter, 95% of those who test positive are put on ARVs and 95% of those who are on ARVs are virally suppressed, when you reach that stage, then you can announce that you have eliminated, not totally eradicated, but eliminated HIV/AIDS as a public health threat. Now, where are we in South Africa? On the 95-95-95 scale, we are on 96-79-94. As you can see, our weakness is in the middle, people on ARVs. We now know there are 1.1 million people in the country, and we know them province by province and district by district, even facility by facility. Those people are not on ARVs. On the 25th of February, we launch a project to start looking for them so that we put them on ARVs. If we find all 1.1 million and put them on ARVs, the 79% will have moved to 95 and will be on the way there. We are working around the clock to do that. In this instance, people thought everything has collapsed when the Americans took out their money through PEPFAR, and we started pointing fingers at each other. Fortunately, we worked with Treasury, which asked us to develop 9 different plans, one for each and every province, and one for the national, and the last one for researchers. And I'm happy today to announce that out of those plans, Treasury has decided to release 753,528,000 rand, which is going to be divided as follows. 590,407,000 will go to provinces as delivery, different province delivery for HIV/AIDS. 32,121,000 will go to the National Department to strengthen central chronic medication and distribution program, and 132 million will be a first tranche to give to researchers, because 2 international organizations, the Bill and Melinda Gates Foundation, as well as the Wellcome Trust, gave us an offer. They said if they offer us 100 million rand each, and Treasury matches it with 200 million, then they'll give that money, and Treasury has agreed. But Treasury said their 400 million to match this will come in tranches over 3 years, and that's why the 132 million rand. Now, because you come from province, you need to understand, out of this 590 million going to provinces, Eastern Cape will get 94 million, Free State 20, Gauteng 94, KwaZulu-Natal 95, Limpopo 69, Mpumalanga 118 million. It just shows how heavily affected they are. Northwest will be allocated 7 million. Northern Cape is not getting anything, unfortunately, not because we are short of money, but because we are financing provinces where PEPFAR was. PEPFAR was never in the Northern Cape, because no district in the Northern Cape qualifies to be a high burden district. And Western Cape will be allocated 90 million. As I said, honorable members, we are very eager to bring HIV/AIDS to an end. Hence, we are very excited about the new prospect. There is a new drug in the field, which is likely to reach our continent in December this year. We're working towards that. It's called lenacapavir. It is given 2 times a year per injection. And through research, it prevents HIV/AIDS 100% in young girls and very substantially in their male counterparts. And we believe if all the young girls, all the adolescent young girls of that age, if they are given lenacapavir, then we'll know that HIV/AIDS will be prevented, not treated. And we've been told by Global Fund to give an offer to be the first country to roll out the drug, we've agreed. We are putting on plans to roll them out. Finally, honorable members, please accept our allocation of 270,842,000. Please accept it, honorable members, and I thank you for your attention.